I would like to welcome you all today. Thank you for making your time available to be here with us today. Thank you for choosing to be here today. My name is Tonga Ligalik and I'll be your presenter for today. Today we'll be talking and interacting, learning more about and to get to introduce to you and of these vulnerable diseases, diabetes. There are 2-day free workshop is recommended for individuals with pre-diabetes and type 2 diabetes. This program is offered on 2 consecutive days, which is today, Wednesday, and Thursday, fortnightly for 1.5 hour max. So for today, we'll be learning and getting to introduce to yourself what is diabetes. For Thursday one, if you want to join that one as well for that workshop, will be an overview of diabetes, which will run from 1 p.m. to 2:30 p.m., which can cover the medication for diabetes and treatment, hemoglobin A1C, and testing blood sugar. So with these workshop objectives, today I want you all at the end of this workshop presentation, attendees should be able to discuss the challenges of managing diabetes in culturally diverse populations. You can be able to describe the criteria for diagnosis and symptoms of diabetes. You will also be able to discuss the risk factors and pathophysiology of diabetes, and also list the target for blood glucose and blood pressure and lipids. There are also some points to consider as we go through this workshop to know diabetes affects racial ethnic minorities in the Auckland region, as it contains the largest population here in New Zealand. Care provided to these groups is often inferior. Diabetes is a complex chronic illness requiring continuous medical care with multifactorial risk reduction strategies beyond glycemic control. Care relies heavily on patient participation and self-management for these diseases of diabetes. Patient-centered interactions are difficult when significant socio-cultural linguistic barriers exist. And lastly, skilled interpreters is vital for pre-diabetes because essential concepts in diabetes are difficult to translate. Okay, with no further ado, let's get into it. What comes into your mind when you think of diabetes? What comes into mind when you think of diabetes? Absolutely, you're right. We think about sugar, we think about overweight, we think comes into mind insulin, diet, therapy, glucose, obesity, high blood sugar, hypo, different type of medicine. Yeah, that is absolutely right. We got to those are a few things that comes into mind as we think about diabetes. With that, what are the symptoms of diabetes? What do you know so far? What are some signs and signals of diabetes? Yes, increased thirst, unexplained weight loss, blurred vision, absolutely. Nausea, yes. Slow healing of cuts or bruises, that one is so hard. Weakness, absolutely. Yes, Anna. Frequent urination, that is absolutely true. Tingling in hands, always tired, always hungry. Absolutely. High blood sugar. Dizziness, yes. Yes, and the numbness in the hands or in the feet. Thank you for sharing those thoughts and those ideas. There are 2 types of diabetes: type 1 and type 2 diabetes. So type 1 cannot be prevented or cured. The body does not create enough insulin. Causes are unknown, but genetics may play a role. requires insulin infections for life. For diabetes type 2, can be prevented through lifestyle modifications. Yes, Anna, that is absolutely right. The body does not create enough insulin or develops insulin resistance. Robert? Exactly. Causes include genetics, aging, inactivity, obesity, and much more. And it also requires insulin as needed, injected or oral. Can also cause other serious health problems and complications. Requires a healthy lifestyle and medical supervision. Yes, absolutely. Include first frequent urination and blurry vision. Those are few things, and various things where you can differentiate a type 1 and a type 2 diabetes. Type 1 diabetes. Type 1 diabetes, also known as juvenile diabetes, it's usually diagnosed in children and young adults when body's own immune system destroys the insulin producing cells of the pancreas, beta cells, which produce the insulin. There's only 5% of people have this disease. Body does not produce insulin. It is not preventable. So we need to be careful. Earlier as you try to prevent it, the much better it is. There is no primary intervention. The causes of this, it's predisposition to diabetes, genetics, and something, example like weather, virus, the environment triggers the disease for type 1 diabetes. For type 2 diabetes, most common form of diabetes, about 90% of cases are the Pacific people here in Auckland. They previously called adult onset, non-insulin independent diabetes. Yes, Anna, that you're absolutely right. So the body produces the insulin, but does not use it properly. Yes, glucose doesn't move into cells, they pile up in the bloodstream. And when they do that, when they do occur, are often ignored because they may not seem serious at the time. It might be earlier because you may not recognize it. So those are the few prevention treatments that we needed to have an eye on, and we needed to try to decrease, and some other prevention that you need to do. You need to stick into a healthy diet, plan a healthy meal. Healthy diet will do prevent diabetes. Weight control, you need to watch on what you're eating. You also need to exercise daily. Less sweets and fizzy drinks. Avoid junk food, and absolutely alcohol control. So for treatment for diabetes, absolutely metformin is the main medication. You also need to stay active, always up and exercise daily. Avoid smoking. Smoking will cause some major influence in your body that the insulin and the glucose won't be able to work along together. Insulin therapy, you need to also maintain and to always check on your blood sugar control. Diagnostic, and as for sure, diabetes medicines, which is the metformin medication and some other medication that they can help lower your blood sugar, and can also be able to when you're hypo, there are some other medication that will help you increase that you needed to balance those diabetes in your body. So it is important to learn healthy habits proven to reduce risk of diabetes. That is 100%. And in this class, there are resources to check your progress and goals as I hand out. So those hands-out and those pile of books, you are to keep it to yourself. Bring it every workshop that we will be doing for the next few months. That we'll be able to interact together, and you can also track on your progress and your goals. It is a supportive atmosphere, good company, learn and motivated from each other. And also bring any question you like to ask and you want to know. We are good. We're good. We're here to learn. We're here to learn and to be able to help one another on what we can be able to support one another as well.